Welcome to ONNpoint. I'm Tim Murphy, and joining me today is Desiree Beck, who is the chair for the Sault Ste. Marie Area Drug Strategy Committee. Hi, Desiree.
Hi, Tim.
Nice to see you. Thanks for coming in.
Yeah, thanks for having me.
This is going to be a pretty interesting half hour, I guarantee it, because Desiree and I are both pretty chatty, and we both have a real passion for helping with the opioid crisis and dealing with addiction and treatment and advocating for people who are suffering from addiction. You have been working in this field now for a number of years. Mm-hmm. How many for you now?
Oh boy, just over 12
wow.
years.
You started very young, didn't
I did.
you? You went to school at Algonquin University to begin with?
Algonquin
College. Sorry,
yep.
It's Ottawa University, Algonquin College.
Yeah.
So, and then what was that for at the college level?
Social service work.
Social service work, and then chose to go on to York University.
Well, actually, I worked for a long time, so I worked in the field.
Oh, you were a social worker in Ottawa for a while?
Yeah, for a couple years, and then I actually moved to the Sault.
Oh.
And then from here, I actually studied at York University.
Oh, you did you do that online kind of thing?
Yeah, the distance thing.
And what did you end up with from York then?
I studied harm reduction.
Oh.
Yeah, so I specifically went to study harm reduction.
I didn't even know they actually just offer something, a specialization in harm reduction.
They do, and it's very fascinating.
Oh, well, I'll bet.
Mm-hmm.
You know what, maybe we could explain harm reduction to people who don't understand. The basis of harm reduction, is that okay? Could you just give me a little rundown?
So the basic concept of harm reduction is that instead of using judgment to look at people's decisions, what they choose to do with themselves, harm reduction is accepting that people are autonomous individuals, and instead of penalizing them for doing things that could be deemed harmful, so using substances, we instead embrace them for their choices and provide them support and education to make the safest possible choice while they're still using substances.
And the outcome that we're looking for using the harm reduction strategy then is to keep people alive and engage them while you're working with them. You engage them and we try to you assist them so that when they're ready, hopefully when they're ready to make different decisions, that you're there to offer the support. As somebody, I think we did an opioid crisis thing together, and somebody said you can't help somebody who's dead.
Yeah, absolutely. And I mean, the basics of if you look at the basics of harm reduction from a very basic standpoint, is that yes, we're trying to keep people alive. We're trying to reduce the disease transmission that happens amongst primarily injection drug use, but also give people who use drugs an identity, because oftentimes the mass amounts of stigma and discrimination that exists towards people who use drugs really dehumanizes them. So we're really trying to make sure that they are acknowledged as individuals. You've
got people who are using methadone clinics, and then you've got people in the community who are saying, oh, those methadone clinics, they make our downtown look terrible, and these druggies, and why do we have to have methadone clinics? Well, but the bottom line is that, once again, these are people who are actually trying to make a change. They're going to the methadone clinics, they're going to their apartments, they're taking their drinks, they're trying to schedule their lives around this, so that they can actually heal or at least stay around long enough to get the help when they're ready for it or to move forward with their treatment, right?
Yeah, absolutely.
So these aren't people who should be shamed, they should be congratulated.
Absolutely. I mean, it comes down to the classic question I think everyone who works in addiction gets is, what's your success rate? Well, success is not a single variant, right? It's a scale, and success is different for everyone. So I would say that for some people, methadone is a huge success, and it's something that we should embrace, and we should really encourage people to access services that exist like that.
The other thing about harm reduction, too, is we're talking safe injection sites. That's a form of harm reduction.
Absolutely.
And there are people who, critics would say, well, all you're doing is enabling. Can you counter that?
I absolutely can counter that.
Thank you.
I would argue that it's actually not enabling. Supervised consumption sites are not providing drugs. What they're doing is they're providing a safe space for someone to go and access medical intervention if they need it. So if by chance, and we know right now that we are not only in the midst of an opioid crisis, but we're also in the midst of a fentanyl crisis, where there are so many different variations of synthetic fentanyl that are hitting the streets right now, that there is really an impossible way for us to know exactly what someone is getting and the toxicity level of that, so how potent it is. So by giving them a safe space to go and consume that substances, what we're saying is, doesn't matter what you're doing, we want to make sure you're safe at the end of the day. So if, God forbid, someone did overdose, there's a medical intervention there to save their life.
I want to talk, when we have to take a quick break.
Sure.
See how fast 5 minutes goes,
I know.
I know. We're going to take a quick break. When we come back, I want to talk about the other aspect of the safe injection site, and that is the engagement process of actually having somebody there that you can then speak to, and they become, and as you say, you're talking about an individual now, not a case,
Yeah,
right?
absolutely.
Okay, and not an addict. This is a person that's sitting down who needs that engagement.
Yeah.
Okay, we will be right back on point and talking to Desiree Beck from the Sault Ste. Marie Area Drug Strategy Committee. Stay with us. We'll be back in 60 seconds. Thanks for staying on point. Joining me is Desiree Beck, who is the chair of the Sault Ste. Marie Area Drug Strategy Committee. We were talking about safe injection sites and about the fact that when someone is using a safe injection site, there is engagement with a health professional.
Yeah, absolutely.
And that is crucial to
it's
someone's,
essential.
because that connection, it's not only a human connection, but it's a personal connection. I mean, if you're seeing that person over and over again, you're going to start talking to them. I mean, you're not just, you tell me.
Yeah, I mean, the one thing I will say is that kind of the philosophy that I would say most harm reduction workers would use or would live by is that if the only thing you know about someone is that they use drugs, you don't know anything about them, right? It's not who they are, it's just something they do in their life. So when you are bringing someone into a supervised consumption site, you have that engagement piece, right? So you can figure out some of the other dynamics that are playing in their lives. Because the other thing we know about substance use is that oftentimes it's not the substance use that's creating a lot of the chaos. It's a lot of the other things that maybe people feel out of control. So by bringing in that engagement piece, we're allowing them dignity so they can use in a safe environment. They have someone to talk to who maybe they deem as a safe person. And then it does allow for additional engagements, right? So is there anything else we can help you with? Do you need any other services today? So it's not just a place for people to go. What I think the stereotype is that they go, they shoot up, they leave, and then we never have any other conversation. It's not a drive-through service. It's actually more complex than that. And it takes trust, right? It takes people building relationships.
And this is not something that hasn't been tried. I mean, there's data, there's stuff to back this up. I mean, the safe injection site in Toronto that was sort of relatively new, Moss Park. Yeah. Right, which is a lot of homelessness. It's a shelter area. I used to live actually in that neighborhood at Dundas and it's around Dundas and Sherbourne. They're having great success there.
Absolutely, yeah.
And so, what would a safe injection site? What do we have for safe injection sites right now in Sault Ste. Marie?
So in the Sault right now, we don't have any supervised consumption sites.
None.
What we do have is harm reduction programming. So there is a number of services in our city that do provide non-judgmental, low threshold services to people who are using substances. But right now, we don't have anywhere where people can go and consume drugs being supervised by medical professionals.
Would you like to see that happen personally?
Oh yeah, absolutely.
You would?
I think if we can offer a space for people to go get B12 injections so it's done safely, they don't have to figure it out on their own, we should be able to do it for people who are injecting drugs as well.
What's the holdup?
So it's actually a long process, and I wish I could say that it's very easy and it's as simple as us providing funding. So there is quite a lengthy process. So your community has to be on board. You have to prove that there's a need here. You have to prove that people would actually use that service. You have to find a building. You have to make sure that people aren't playing the NIMBY card, right? So not in my backyard. And I think ultimately you have to get more community buy-in than anyone really realizes, but also you have to show that there's a need. We all know that funding comes down to data and evidence. And so a big thing for our community is we did get City Council on board. City Council acknowledged and recognized that we are in a state of crisis here in our own community and that we do need an increase of service. So that's a big bonus for us, but it is quite a process for us to get there.
And just also to clarify a point, because I think there's been some misinformation that's out there, you have an excellent relationship with our mayor, is that correct?
Oh, absolutely.
Yeah, I know.
He's delightful. Yeah.
I just wanted to say that because
we all know why.
Yeah.
But no, he's absolutely supportive. He's wonderful, and especially in terms of the drug strategy. He came and supported our gala, our fundraiser we had last week, and he is consistently communicating with us to check in to see how things are going. He's very supportive of what we're doing.
It's good to hear. You have a lot of support in this community.
Yes.
I mean, your committee is made up of how many organizations? 20 or something, or more?
I believe so. We're about 20. We are 20 approximately 20 individuals that represent about 16 different organizations throughout the city.
Let's talk more about the committee when we come back. It's time for another quick break. We'll be back in 60 seconds. You are On Point with Tim Murphy and Desiree Beck. We'll be right back. This is Desiree Beck joining me from the Sault Ste. Marie Area Drug Strategy Committee. Sorry, Desiree, thanks. It is, but that's okay. It's a mouthful because there's a lot of you involved. You said 16 different agencies, 20 people on the committee. Algoma Public Health is involved.
Yeah. So Algoma Public Health, there's Group Health Center, a new link, the Sault Ste. Marie Police Service.
Sault Area Hospitals.
Sault Area Hospital. We have representation from paramedics around the table.
Oh, yes.
Mental health services, so Canadian Mental Health Association.
Great, yeah.
Oh my goodness.
That's okay. You know
Yeah,
what?
there's so many people.
I didn't expect you to sit here and name off 16 agencies. It's just to know that there are a number of agencies that are. And you said there's a term that is often used when you're working in social services or any kind of bureaucracy is the silos, that people tend to work in their own environment, on their own cases, and there's a lack of shared information, a lack of collaboration, and that is, it's not an easy thing to beat down when you're working in these government agencies or in any situation when you're not in the same office building and you're working on common things, but you all have different focuses in addition to this one thing you have in common. So what you were telling me was that these 16 agencies have really done a great job of taking apart, knocking down those silos. And so how is it you get together then, and the communication between you, among you?
As a committee, we meet on a monthly basis, and the one thing that I really do have to acknowledge every single person who sits around that table, including Shauna Thomas, who is the co-chair of the committee.
Shauna from Algoma Public Health,
Algoma Public Health.
CADAP,
Yeah, so she, so a part of our committee, when we get together, there's obviously a huge, there's a huge impact of the opioid crisis around everyone who sits around that table. So it doesn't matter what service you work in, what program you work in, we are all being affected by the opioid crisis. And when we started to acknowledge this, really our communication changed. So we are always able to contact each other via email. But we've also had this almost, I'm going to use a cheesy word, but like beautiful connection where we support each other when we need to, because we understand that all these agencies, AFS, APH, Group Health Center, all of these places, we're all being impacted by what's happening. And so we've been able to really break down those sometimes hard walls of communication so we can talk to each other whenever we need. So if there is something, what seems silly, like, oh, hey, I have a question about this, we can reach out to the entire committee, ask that question, right down to, hey, we've had a lot of reports of drugs, this drug that's going around our community that's potentially tainted. Can you please spread the word?
That was something when I used to do the youth engagement theater thing, and we did a lot of stuff on substance use and misuse. And one of the things that I always appreciated was when news would come down the pipe saying, okay, right now there's something that's got to Winnipeg, and there are people that you can follow the map. It came in from China through Vancouver, and it's making its way across, and we're counting the deaths, and we're seeing it come. Molly was one thing. It's like a form of ecstasy, and at one time there was a bad batch of Molly that was going around. And this was interesting because it was something that wasn't really on the radar. Molly wasn't really on the radar at that time locally, and then suddenly I'm hearing, oh, people aren't doing E anymore, they're doing Molly. I'm like, what's Molly? And then you find out it's this party drug and that it was tainted and it was bad. And it was great. It was good to know this stuff, because then you're talking with high school kids, you could say, listen, if you're at a party and somebody says, I want you to try some Molly, not a good idea right about now, because this stuff is like, you can watch the trail, right? Yeah, and I mean, another representative we have on the committee is someone from the Algoma District School Board, and so it's wonderful to be able to provide him information so that he can actually share that amongst the schools, right? We want to make sure that when youth are experimenting with substances, we want to make sure that they are safe and supported and that they have the most up-to-date information so that we see them tomorrow. So that's the biggest thing, right? Because you can always tell over and over again, don't do it, don't do it, don't do it. But we know that doesn't work. Does not work. All right. Nancy Reagan, just say no. Yeah, and that's the philosophy of harm reduction as well, right? So instead of saying no, let's give you the most. It's setting someone up for success. Right. So if we give you every possible piece of information about what's actually going to happen and what the real outcomes are going to be, we're setting you up for success because you're able to make informed choices versus just say no, which doesn't talk about anything, which makes people feel very weary about opening a door and asking for help. So let's talk about people asking for help when we come back. Okay. We have another 60-second break coming up on Point with Desiree Beck from the Sault Ste. Marie Area Drug Strategy Committee. We'll see you in 60 seconds. So Desiree, I want to talk about the difference between a crisis and an emergency. So last year, I believe it was, there were 700 physicians and they signed a letter that went to the Minister of Health for Ontario. And they were requesting that he declare an emergency, a public health emergency because of the opioid crisis. And they said that they wanted him to release some emergency funds, and sort of the response was, well, actions are more important than words, so I'm not going to call it an emergency. We're going to leave it at a crisis, and we're going to put $222 million into additional services and stuff like that. But they wouldn't actually deem it an emergency, which in British Columbia they did. That minister called it an emergency, and I think that means they have to, every 14 days, they have to rename it an emergency. So what was SARS? Was SARS an emergency?
I don't know what SARS was, but the
we know what the outbreak was, but I mean, what did they deem it as?
I don't actually know, to be honest, but what I can say, if you compare the two situations, I think actually it was declared a public health emergency, maybe?
I think. But the deal is that if we're...
Emergency is like right now.
Right.
Crisis is like, seems to be like, oh, okay, we're in a crisis.
We know it's here and we're working on it, whereas an emergency is like, this is dire.
Yes.
We need support immediately and in this form.
Yeah, and so when you compare the two scenarios during the SARS emergency or crisis, the government stepped in right away. There was an
immediate response to SARS.
And there was, this is Michael Parkinson talked a lot about this when he was here, and
he was one of the gentlemen they brought up for that.
He's from
the Family Matters conference.
Yes, and so he, he did a really great job at articulating the difference between the two. So I'm kind of stealing this from him, but
I'm sure he wouldn't mind.
No, I don't think so. But it's a very, if you compare the two, they're looked at entirely different. The SARS crisis, if you want to call it that, had, I believe, less than 5 deaths across the country. So there was an immediate response. Hospitals were shut down. There were public health protocols put into place. Nurses were hired. I was in high school, but there were protocols put in my high school, for goodness sake. And so there was this huge response.
I was in Toronto when people were going around with masks on everywhere.
And they were putting them in public places. Hand sanitizer was everywhere. So there
that was when that all first came out.
And so there were all of these prevention, there was the major upheaval of public health issues put into protocol put into place to combat that issue.
Yes.
If you compare it, we in the harm reduction, the addiction world, we have been advocating and vocalizing concern about this opioid crisis or the impending crisis for years, and no one's listening. And now here we've lost thousands upon thousands of people, and there's still no response. I mean, great, give money, that's wonderful. Allow us to open supervised consumption sites, allow overdose prevention sites to be there, but there's still such a mass procedure to get those things put into place. It's not the same. And it does show the hierarchy of personhood, right? So someone who's being affected by SARS is valued. Someone who uses drugs is not. And that's really what it comes down to. It's a human rights violation.
I like how you said that.
Thank you.
Because it's true.
It is true.
I know it's true. They're not, people who are addicts are not as valued members of society as people who are not addicts. And I'll tell you something. I don't think that I'm any less valuable because I made the mistake once of picking up a crack pipe. If I had known what was going to happen, I wouldn't have done it. But I did, and I don't think that I deserve to be labeled as someone who's less than anyone else because I was living that life for 5 years. And if I hadn't had the people that support me, I wouldn't have come through it, and not everyone has the benefits that I had in my life and in my situation. So to judge someone simply based on a choice that they might have made once in their life, and then the whole nature of addiction is that choice is taken away.
Right.
And that's what people who aren't addicts don't understand.
And it also really, it puts a hierarchy on drug use, right? So it's also not just chaotic or overwhelming drug use that we're talking. We're not just talking about addiction. People recreationally use substances as well,
right?
And they're being affected by
They
this
certainly
crisis.
are, absolutely.
So we are blanketing all drug use as being. It's this. I have this. I like to explain it as when it comes to drugs, there's a moral thread woven through that doesn't belong there. It needs to be pulled out. It has nothing to do with morality. It has to do with autonomy and people's ability to make choices.
We're going to come right back with Desiree Beck, ONNpoint. Stay with us. See you in 60 seconds. We're back to wrap things up with Desiree Beck from the Sault Ste. Marie Area Drug Strategy Committee. You were talking about people who are looking for help. Where can they turn, Desiree?
There are so many services that exist within our city, and although sometimes it seems challenging, sometimes a good starting point is to call 211, call Connects, call any agency that you know and just ask. And
right.
we have a lot of referrals that go out, and I know the process can seem frustrating and timelines seem like they're taking a really a long time. But what I can say is that every single frontline worker in our community is working very hard to make sure that the needs of people are being met.
We had Annette Kadajimaki in from Canadian Mental Health Association, and and as well as Barb Goff from Algoma Family Services. They were talking about the mental health walk-in clinics that are conducted every Wednesday. Tuesdays. Thank you. And you can go without an appointment.
Absolutely.
I think they start at 11 o'clock in the morning and they go till 7, but the last appointment's at 5, I believe.
Yes.
So once again, if someone is just want someone to talk to right away, you can without making an appointment. Oftentimes the hardest thing to do for an addict is to make that phone call or make that visit. So then I would also recommend that if you are a family member or a friend of someone and you want to help them, as an addict and someone who's been through the system, I always say that if it hadn't been for my sisters doing the legwork for me and finding out about the resources that were out there, my sister had all my ducks in a row for me, and all I had to do was make one of those phone calls. She had the numbers for me. She had all the contact information. I would never have done that on myself when I was using.
Yeah.
So if you are a family member or a friend, don't be afraid to talk about this and let this person know that you have this information. You can share it with them.
Yeah.
And it's as easy as also calling the group health center, asking for information, calling Algoma Public Health, make a phone, and you will get directed.
The resource center, the
neighborhood resource center on Gore Street is fantastic too. Constable Troy Miller was in earlier this week as well, talking about the Hope campaign, Hope Alliance. So the help is out there.
It is.
There are still some issues with waiting lists. We know this is but we are, as you say, the frontline workers are there. They're doing their best.
Yeah.
I believe that you have reduced a lot of gaps in the system.
We're trying.
I know you are. You need to keep trying, because now tell us how many people we have lost in our country.
So in 2017, because of the opioid crisis, we've lost approximately 5,000 individuals. And so when you think of the local impact,
that's in 1 year.
That's in 1 year. So I think I could be off on the exact percentage, but I believe it was a 46% increase from 2016.
Oh,
so we're seeing drastic rates. So we are in the midst, it's very much an opioid crisis. And I know that British Columbia, Vancouver gets a lot of attention around the amount of deaths that they've had provincially, but also isolated in the one city. But if you look at the province of British Columbia, compared to the province of Ontario, we're not that far behind in the death rate.
Really?
So it is important for people to acknowledge that it's happening here. And, go easy on your frontline workers. We are working very diligently. I work alongside a number of very dedicated, very hardworking people who are putting their all into making sure that the people that we serve, that we care about, are being taken care of.
And I've been fortunate enough to have been involved in 2 different meetings. What would you call them? I guess the one at Sioux College that we attended.
Oh, yeah.
And the one at the Tech.
Panels.
Yeah, the panels, the information panels and those information sessions. And those are so important too, because I believe that it's, as long as the community sees that there is action being taken and it remains in, we can't let it go. It has to remain in the fore.
Yeah, and I think the great part about the most recent one, the Family Matters panel that was put on, was these, these 5 individuals were brought into town, and it was really encouraging because, you know, from a small community perspective, I think sometimes when you look from the outside in, it appears that we're not doing anything. But these 5 people were brought here, and we're really encouraged by what actually is happening here. So, you know, to see them be positive about what they see going on in our community, and maybe everyone doesn't hear about it, and I appreciate that that's frustrating. But they had a lot of really positive things to say about what's happening here, a lot of encouraging words. And so that was a nice thing to see people come in, see that we are suffering in our own way compared, you know, to big urban centers, but that we're doing okay. So we're not doing the best, but we're still doing okay.
Well, I wish you all the best.
Thanks.
Continued success in your endeavors. The Neighborhood Resource Center is a great place for information.
Absolutely.
And so I would recommend anybody who has any questions, head down there.
Absolutely.
And visit you guys. All right, and you hang around there once in a while, eh?
I do. I hang out there on Fridays.
Well, I'm going to come down and hang out with you too sometime. All right, and thanks for hanging out with me.
Thanks,
This has
anytime.
been on. Oh, where am I? Oh, there I am. Hi. Thanks for tuning in. We'll see you next time on ONNpoint on TV.